So there's currently 5 patient and carer participation groups running across Swansea, one in each GP cluster network. So that's Llwch, Penderry, City, Cwm Tower and Bay. The overall aim of the project is to enable patients and carers to have an active involvement in the delivery, design and delivery of local services, primary services such as GPs, dentists, pharmacies and also social services. The main objectives of the project are to raise awareness of local services, share views on the services that are currently received, and also to work with service providers from primary care and social services to develop and deliver an improved service.
I've learnt a lot actually about being in it, particularly numerous medical topics, people coming to give us a talk, like we had a pharmacist about the big fight, came to give us about the big fight. We had a lady last week and a lot of things about stress and things like that, and also what you can get out of the carers group, which I don't think I knew anything about. I represent a ladies' Wednesday morning club actually. I know I'm in the Penderry, but we've got a ladies' Wednesday morning club. Their ages are from 66 to 92. We have wonderful things, but they didn't know any of this, so I go back and I report to them, and the surprising, they said they didn't realise things that we could do or what they could get. You know, so it has helped me as well, and meeting these lovely young ladies. And they do like, my ladies thought the brochures that we get, particularly the book on falls, because at our age, I mean, I'm nearly 83, books on our age, it tells you, you're so easy, you can fall so easily, which I've done twice, so I know what it meant, and they couldn't get over that, they thought it was great.
From the point of view of the practice and the other practices within the cluster, the greatest benefit has been the opportunity to just sit and talk with people and get both sides of the story, because we've been able to hear the patient's experience and the carer's experience, but we've also been able to explain why some of those things are put in place that can seem really obstructive to patients until they understand the reasoning behind it. So it's about working together.
Right, what I get out of it is meeting people that are experiencing the same sort of problems, and also meeting people like the practice manager by year, right? It put me right on a couple of things which I was, you know, I needed probably to be put right on. But that's what it's all about: talking and discussing and finding and resolving problems. You know,
as a cluster of GPs, we had a particular issue with management of mental health problems for young children. We introduced a CBT, which is cognitive behaviour therapy, counselling service for adults, about 1.5 years, 2 years ago, with funding from the group. But we were becoming more and more aware that referrals to the NHS CAMS system were falling between 2 planks of wood and just getting lost, and children were in danger. So we discussed it within the group. They agreed that that was something that was important to them. So we took it back to the group of GPs and looked at the funding, and we've now, from the end of March, beginning of April, have introduced a counselling service for children over the age of 3 up to the age of 18, which has really filled a huge gap in service delivery, and hopefully will change the lives of a lot of people, and especially a lot of children. And I'm not sure that we would have necessarily realised that gap in the service had people like Victoria and her colleagues in the group not brought it to our attention. So that's one real example of where the group have influenced the service.
For me, the child and the CAMS, as Jo has said, raising awareness for mental health within children and young people, I think it's overseen. You know, I don't think it's taken as serious as it should be. And again, I think post-traumatic stress disorder again is overlooked within children. Apparently they don't suffer with these things, but I know they do. You know, and I raise awareness as well around autism, and Jo again, you know, she's worked with me on that. It's having these conversations. That's how we make changes. It's getting together with the right people like Joanne, like Charlotte, Beth, and various, other members. That's the way we move forward, really. Is having those conversations.
Yes, I think so, because Deborah comes, doesn't she, and she's very good, and she takes down what we're saying and she brings us back that information, or she lets them know what we want and she brings it back to us then.
We've, in Llwchwyr, we've recently had the Director of Primary and Community Care do a presentation on the consultation period for the new strategy for primary and community care, and that gave people within the group a great deal of opportunity to discuss how they view primary care and community care and what they would like to see considered as the priorities for the future. So they might not be embedded as yet, but at least they've been given the opportunity to feed into that process so that when they are looking at that new strategy, those things will be in their minds, hopefully.
I think what's changed as well is the fact that you're looking at expert patients these days. People know
Yes.
their health, they know
Got the
disabilities.
internet, yeah.
There's internet, there's information out there.
Yeah.
So we have become expert patients, carers. We are doing our own homework. So we can help because we understand more, and we're able to manage our own health, and we're able to say where things could be improved, if you like, if you thought of doing things this way instead of that way, and we can help save money actually. I say that with a smile because I know we can.
I feel exactly the same, that it could result in saving time, money, if we are listened to, because we understand the problems, and together we can work through the problems, and I believe it's the only way to do it. In the past, yes, they listened to our voices but never done anything about it, but I believe this time our voices not only got to be heard, they actually got to be implemented and worked upon. Our feelings and our thoughts can contribute greatly to a better system altogether.
And I think if anything, that's the better benefit of doing it within a cluster. Is it's not just one surgery, it's 5 or 6 or even 7 in some of the clusters, and then you've got more chance of something being funded when you're not just talking to one surgery who might not have any control over any funding. Within the clusters there is a pot of money that we can use, so it is about working together, not just the group but all of those GP practices as well.
It's true.
And we are approachable, and we do have conversations, and we do actively listen, because I suppose for some it may be quite daunting to meet with patients, and carers, because I guess that there's an idea out there where we could be, demanding or quite confrontational, but actually no, we don't have a wish list. We do know where to make some changes. We don't have all the answers, but we're prepared to work with you, really, isn't it?
Together we'll have all the answers. I believe.
Absolutely.
Yeah.
I see the major key factor is that I'm here. Right? I'll be honest with you, because I'm not going to get involved with any committee that I don't feel is going to get anywhere, and I feel from the beginning that this committee is actually going to get somewhere, right? It's going to be a tangible effect at the end, which is going to be beneficial to us all, and I'm sticking in for the long run, so that's me.
I think that having people come and talk to us about different things, when they come in to talk to us now, at least because we got Deborah and Beth, and Jean comes with us now. I've got somebody else to come with me. She's our treasurer of our Wednesday club, and it's just getting someone to come and explain different things to you, and that does make a difference. And you're talking, I'm talking, 'cause I do get panic attacks, and it makes me come and do things and take a deep breath. But this is the sort of thing, I'm just, alright, there's a lot of people much younger than me getting panic attacks, I know, but in the people that I deal with, they're all older, I'm not saying elderly, but older people, and you all get stressed at some time, and they don't see somebody from one week to the other, and they can't talk. So when they come to us, and I can give a report and say, which I do, it's lovely, and they say, well, I had one of those attacks, what do I do? Take a deep breath, I said, nobody knows when you're going to have a panic attack, and that's quite true. You don't know when it's coming. You don't know what caused it. If you knew what caused it, you'd be able to do something about it. But by talking about it and having people come in to tell you about these different things, it works for me. Say that as someone my age, I find that it gives me an open mind about the health service, and also gives me confidence as an old age pensioner that I am still considered young enough to participate in these groups.
I think from a service provider's point of view, at the end of the day, we've got to remember that we are here to provide a service to the patients, and we can either do that and completely block them out and just get lots and lots of complaints, or we can work with them and try and find some happy medium as to meeting what they want with what we are able to provide. We can't do it all. There's not enough doctors, there's not enough money, there's not enough hours in the day. But at least if we've got that conversation going on, we've got more chance of agreeing on a middle line somewhere.
I like to go back to the old adage, the more the merrier. Right, the more the merrier, and the more will get done. More people, with more people, I like to encourage anybody to get involved. Anybody that cares anything about the community or the general health and well-being, or people within the community who can't speak for themselves, get up and come to these meetings and speak up for them, because that's the only way we're going to go. That's the only way we're going to get things done.
I think greater involvement in a smaller number of groups, as I said earlier, groups for the clusters, rather than lots and lots of small groups for individual surgeries. It gives a bigger voice, if it's across a number of surgeries, that's more likely to get heard. So I'd rather see the membership of the individual cluster groups increase, rather than surgeries feeling that they need to go off and have a group per surgery, because it's unsustainable, and there then isn't a voice. There's so many little voices that nobody gets heard.
I agree with that.
Yeah. I want to add that coming to these groups, you actually, as Joe had stated earlier, it pointed out even, it's working together, so it helps us to understand what it's like for yourself in your situation, and also as a patient, it helps us to help them understand our perspective or our experience, because unless we have these conversations, how on earth could each GP understand our circumstances? So to go to these groups and have those conversations, and everyone's willing to listen to us, they really are. Otherwise, like yourself, I wouldn't come. Our views are very much valued and listened to. And Joe's made a difference to our group.
And those conversations have actually identified areas where practice staff need training, not just doctors, not just the medical side of it, but the staff in how they approach people, and we've had receptionists in the area who've been trained in dementia awareness and also autism awareness.
Hoping to make a change, hoping to make things better. That's why, because I think many of us have been through the system and seen the faults in the system, and we hope to rectify them or help to put them faults right. That's what I feel, and that's why I'm going to keep coming back. I keep coming back till we actually achieve something, something tangible.
For me, firstly, it's the members. Every member, what's your role? Sorry. I forgot. We've had different various...
I'm the patient and carer participation development officer.
You'd have to get rid of that bit.
Yeah.
The patient development officer. We've had a few changes, but each and every one of them have been, have valued everything we've said. They've been very friendly, approachable. We feel very much valued. That the members, the professional members, have come along, and they're committed. They listen to us. They value us, and even the people that come to speak to us. And I think because we're being listened to and valued, and then something's been done with our concerns. For example, Beth recently set up a meeting with the pharmacies. One of the bosses, I think it was. Yeah, it was one of the main people, bosses. Yeah. And there's been some concerns around some of the pharmacies in Gysainen. So myself and another member went along to meet with them along with Beth, and just having those conversations, you know, pointing out how we're struggling to actually enter some of these pharmacies, and there's a wall in the way, and there's the cars, you know, just simple changes need to be made. But we've gone along, they've taken on board, they didn't see these as issues or concerns, you know, they just didn't see it. We pointed it out and they're doing something about it. So things like that make a difference to people. So yes, that's why I keep coming back, because we are listened to.
I keep coming back because I enjoy coming there. I enjoy these people who come in to give us talks about different things.
Yeah.
I've learned a lot, and I'm so pleased I can give it to other people what I've learned, and I'm expecting something new to be coming out. You know, if there's anything going to come on the market sort of thing, I want to know about it so that I can tell my group. So, and I must be honest, I do enjoy speaking to these ladies.
Say anything else?
I think we're all in agreement with,
Yes.
you know what I mean, that we're working in an happy medium, and you know, we hope to get things done. And I think, you know, it's nice to meet people that you're working with, not against.
Yes.
You know, people who come in to listen to your views, as the lady said, yeah, you know, listen to your views, not to argue with you, you know, just to listen.
It's just a two-way conversation.
It's a two-way
isn't it?
conversation, exactly, you know. Yeah, that's what I feel, and I'm quite happy with it at the moment, you know, so.
And it has to continue. We need to
We have
carry
to
on.
continue, right? We have to continue. So anybody out there, right, that's holding the purse strings, right? Don't forget funding for these groups, right? Because we need it. We need it.
And in the long term, we'll save you money.
Yeah, and that's not any organisation asking you. That's us, the people, the patients, the carers, the people that's working for nothing to look after other people. That's us asking. Keep the money coming.
And I think our lot in Penderry, we need that for the
Yeah.
area that we're in. We do need to keep these groups going.
Yes.
I'm sorry,
yes.
I know we're not many,
Yeah.
but we definitely need it.
Yeah.
Our
Yeah.
groups, look, we've been very lucky because Joanne we've managed to actually make sure that we have got funding in place to continue. So thank you.
And we're not talking huge sums of money.
No.
Just to support the group is not a huge amount of money. And it's important.
Mm.